This is Robert. He has diabetes and needs insulin to survive. If he lived in Canada, he'd pay $12 for 1 unit of insulin. If he lived in the UK, he'd pay $7.25. But because he lives in the United States, in my hometown of St. Louis, he pays on average $98.70 for 1 unit of insulin. 7 million people in this country need insulin every day to survive. 1 in 4 of them say they ration their medicine because it's too expensive. At the heart of this crisis is that our prescription drug system is designed to increase the cost of drugs to maximize profits for drug companies.
I was diagnosed at maybe about 12 or 13. One particular time, I just kind of felt that my parents were kind of stressed financially, and so I ran out of insulin, and I just didn't want to stress my parents, and so I just didn't take the insulin for almost a week, and almost died. Was almost in a diabetic coma. I had been sleeping all day. That's when I really understood that, if you don't take your insulin, you could die.
I saw these choices play out as a nurse. I've seen patients ration insulin. I've seen patients become amputees. As a result, I've seen patients die, all because they couldn't afford a drug that they needed to live.
This is a life or death situation. It's not a, well, if I don't take it and I'm fine. It's life or death.
Thanks to Big Pharma, the ultra-powerful lobbying arm for the pharmaceutical industry, our government legally cannot negotiate with prescription drug companies. While other countries have the systems that keep the prices of life-saving medications down, the U.S. does not. That means pharmaceutical companies charge people in America as much as they want for medicines we need to survive, completely unchecked. Just 3 companies, Sanofi, Eli Lilly, and Novo Nordisk, control 90% of the world's insulin supply. Over the last decade, they have worked in tandem to triple the price of insulin, raking in record profits. All the while, millions of people struggle to scrape together $300 per month for a life-saving medication that costs these companies less than $6 to make. But it doesn't have to be this way.
Democratic U.S. lawmakers just unveiled a plan to cut costs of prescription medications.
Another provision added to the bill would reduce the price of insulin to no more than $35 per dose.
What I really like about the plan is capping the copay for insulin at $35, because most insulin right now is probably over $500.
I ran for Congress to do the most for everyone, beginning with those who have the least, and to rebuild our healthcare system into one that guarantees healthcare as a human right for everyone. That means we need to take on Big Pharma and the rest of the corrupt lobbyists who buy politicians and make billions off the suffering of people like us. For Robert, for the millions of children and families who are struggling to afford insulin. We can't let Big Pharma keep getting rich off of a drug that we need to survive.